Here's a comprehensive and detailed explanation of nasal swab culture, covering all 15 points thoroughly for academic, clinical, or exam preparation purposes. Introduction. A nasal swab culture is a diagnostic microbiological test used to detect infectious organisms such as bacteria, fungi, or viruses in the nasal cavity, particularly the anterior nares or nasopharynx. It is an important tool in clinical diagnostics, infection surveillance, especially in hospitals, and in preoperative screenings. This test is simple, minimally invasive, and vital in identifying carriers of pathogens like methicillin-resistant Staphylococcus aureus A. 2. Definition. A nasal swab culture is a laboratory test in which a sterile swab is used to collect a specimen from the nasal mucosa, which is then cultured in a laboratory to check for the growth of pathogenic organisms. The purpose is to identify the specific microorganism responsible for a nasal or systemic infection, or to screen for asymptomatic carriers. And 3. Indications. The test is indicated in a variety of clinical situations: suspected upper respiratory tract infections, e.g. rhinitis, sinusitis, screening for MRSA colonization, particularly in hospitalized or pre-surgical patients, chronic nasal discharge or congestion, not responding to standard treatment, infection outbreaks in hospital or communal settings, persistent nasal symptoms such as malodor or purulent discharge, postoperative infections after nasal surgeries, immunocompromised patients with possible opportunistic infections. Used for identification of nasal pathogens, bacteria, fungi, occasionally viruses, MRSA screening before surgery or hospitalization, guidance for targeted antimicrobial therapy, surveillance in healthcare institutions, public health measures during infectious disease outbreaks, monitoring colonization in individuals with recurrent infections. How to 5. Why do need of this test? To determine the specific cause of nasal infections or persistent nasal symptoms, to detect asymptomatic carriers of dangerous bacteria like MRSA who may spread infection, to avoid unnecessary broad-spectrum antibiotic use, to assess the effectiveness of treatment, to help in infection control protocols in hospitals or nursing homes, to provide baseline information for pre-surgical or ICU patients. 6. What happens during the test? The procedure is simple and usually takes less than 5 minutes. 1. The patient may be asked to tilt their head back. 2. A healthcare provider inserts a sterile swab, usually made of rayon or Dacron with a plastic shaft, into the nostril and gently rotates it against the nasal walls to collect a sample. 3. If a nasopharyngeal sample is needed, the swab is inserted deeper into the back of the nasal cavity. 4. The swab is then placed in a transport medium and sent to the laboratory. 5. In the lab, the sample is cultured on agar plates and observed for growth of organisms. 6. If growth occurs, organisms are identified and tested for antibiotic susceptibility. 7. How long for my results? Bacterial cultures, results usually available within 24 to 72 hours. Fungal cultures may take several days to weeks, depending on the species. PCR or rapid antigen tests, if performed, results may be available within 1 to 4 hours. Susceptibility testing, if needed, may take an additional 24 to 48 hours. 8. Prepare for this test. Generally, no special preparation is needed. Inform your healthcare provider if you are currently on antibiotics, which may affect culture results. You've used nasal sprays or antiseptics, which may interfere with sample accuracy. You have nasal trauma, bleeding disorders, or recent nasal surgery. You may be advised to avoid blowing your nose before the test. Risks. This is a low-risk and non-invasive procedure, but minor side effects can occur. Mild discomfort or tickling during sample collection, temporary sneezing or coughing, rare cases of nosebleed, epistaxis, or irritation, gag reflex, if a nasopharyngeal swab is taken, extremely rare cases of vasovagal reaction, dizziness or fainting. 10. Normal values. No growth of pathogenic organisms, growth of normal nasal flora, such as Corynebacterium spp, coagulase negative Staphylococcus, non-pathogenic Neisseria spp, Micrococcus p, absence of virulent pathogens like Staphylococcus aureus, Streptococcus pneumonia, Pseudomonas aeruginosa, Haemophilus influenza. Narrative 11. Interpretation of results. Negative result. No pathogenic bacteria or fungi detected. Indicates a non-infectious cause or effective treatment. Positive result. Specific organism is isolated and identified. Sensitivity antibiotic susceptibility testing helps guide targeted therapy. Mixed flora may indicate contamination or a mixed infection. Interpretation depends on clinical symptoms and history. HARA 12. Factors affecting results. Recent antibiotic therapy can suppress microbial growth. Improper specimen collection technique. Contamination during sample handling. Delayed transport or incorrect storage of the specimen. Use of nasal decongestants or sprays before testing. Immune status of the patient may affect microbial colonization. HA 13. Clinical significance. Helps diagnose bacterial infections such as sinusitis, rhinitis, or cellulitis. Critical for detecting MRSA colonization, especially in surgical or ICU patients. Prevents unnecessary use of broad-spectrum antibiotics by guiding targeted therapy. Assists in epidemiological surveillance and infection control. Aids in managing chronic nasal conditions and reducing recurrence of infections. 14. No more. Nasal swabs differ from nasopharyngeal swabs. The former are taken from the front part of the nose, while the latter go deeper into the nasal cavity. In COVID-19 and influenza testing, nasopharyngeal swabs are preferred for detecting viral RNA via PCR. Point-of-care tests and rapid PCRs may be used as adjuncts for faster diagnosis in emergency settings. Some facilities use chromogenic media to quickly identify MRSA from nasal swabs. Carriers of MRSA may require decolonization therapy using mupirocin ointment or chlorhexidine washes. 15. Conclusion. A nasal swab culture is a straightforward yet powerful tool for detecting pathogens in the nasal cavity. It is essential for diagnosing infections, guiding appropriate therapy, preventing the spread of hospital-acquired infections, and monitoring colonization in high-risk populations. Its accuracy, low cost, and non-invasiveness make it a cornerstone in clinical microbiology, infection control, and public health surveillance. Thank you. Have a nice day.